It starts as a routine, a tiny white pill costing less than your morning latte that you pop without a second thought. It's been prescribed by your doctor, recommended by your friends, and advertised as a lifesaver for millions. We are told it prevents heart attacks. We are told it saves lives. But what if I told you that for a massive portion of the population, this $5 wonder drug is actually a silent saboteur? A chemical agent that, while doing one job, is slowly, methodically corroding the very vessels that keep you alive. Today we are pulling back the curtain on one of the most controversial and misunderstood medications in modern history. A drug taken daily by over 40 million Americans alone, often pushed as a mandatory daily vitamin for the aging population, yet riddled with side effects that are rarely discussed in a standard 15-minute doctor's visit. We are talking about the lowly aspirin, specifically daily low-dose aspirin therapy.
But wait, you might say, aspirin is a miracle drug. It comes from willow bark. It's natural. And you are right to an extent. However, the daily consumption of acetyl salicylic acid is a different beast entirely. We are going to explore the aspirin paradox, the fine line between primary prevention and silent destruction. We will dive deep into the mechanism of how this drug interacts with your endothelial lining, the emerging evidence about vascular calcification, and why the FDA and the American Heart Association have done a massive U-turn on their recommendations. By the end of this video, you will never look at that little white bottle the same way again. You will understand why an apple a day was a safer saying than an aspirin a day. To understand why we are in this predicament, we have to go back to the roots. Aspirin is one of the oldest pharmacologic agents in human history. The ancient Egyptians used willow bark for inflammation, and Hippocrates himself prescribed it for fever and pain. But it wasn't until the late 19th century that a German chemist named Felix Hoffmann, working for Bayer, synthesized acetyl salicylic acid to create a stable, less irritating painkiller. It was a massive hit. By the early 1900s, aspirin was the go-to drug for headaches, fevers, and rheumatism. But the real game changer came in the 1970s and 80s. A British pharmacologist named John Vane discovered that aspirin works by inhibiting an enzyme called cyclooxygenase, or COX for short. This discovery won him the Nobel Prize. By blocking COX, aspirin stops the production of prostaglandins and thromboxanes. Prostaglandins cause pain and inflammation, so blocking them gets rid of your headache. Thromboxanes, on the other hand, cause platelets to stick together and form clots. So blocking them meant that aspirin could stop blood clots. And that was the eureka moment. If aspirin stops blood clots, it could prevent heart attacks and strokes, because most heart attacks and strokes are caused by a clot blocking a blood vessel in the heart or the brain. Suddenly, aspirin was no longer just a painkiller, it was a cardiovascular shield. Cardiologists started recommending it to anyone over the age of 50, regardless of whether they had heart disease or not. This was the birth of the daily baby aspirin. Now let's talk about that $5 price tag. You can buy a bottle of 81 milligram aspirin at any dollar store for about $5. That bottle contains 300 tablets. That is less than 2 cents a day. When you compare that to expensive blood thinners or cholesterol drugs that cost hundreds of dollars a month, aspirin looks like a financial no-brainer. Insurance companies loved it. Doctors loved it because it required no prior authorization. And patients loved it because it was cheap and easy. It became the poster child for preventive medicine. But here's where the story takes a dark turn.
You see, there is a fundamental difference between treating an existing disease and preventing a disease in a healthy person. In medicine, this is called the difference between secondary prevention and primary prevention. Secondary prevention means you have already had a heart attack or a stroke and you take aspirin to stop it from happening again. In that case, the benefits of aspirin clearly outweigh the risks because you are a high-risk patient. Primary prevention, however, means you are a healthy person with no history of heart disease and you take aspirin just in case. And this is where the science gets murky. For decades, the medical establishment pushed primary prevention aspirin for everyone over a certain age. But slowly, the evidence started to crack. In 2018, 3 massive clinical trials were published almost simultaneously. They were called Aspirin, Arrive, and Ascend. These trials collectively followed over 100,000 patients for years, and the results were shocking. They found that for healthy individuals, the benefit of aspirin in preventing a first heart attack was so small that it was statistically negligible. At the same time, the risk of serious bleeding was not negligible at all. In fact, aspirin increased the risk of major gastrointestinal bleeding and hemorrhagic stroke, which is bleeding in the brain, by a significant margin. Let me repeat that. For healthy people, aspirin did not save lives. It did not reduce mortality. All it did was shift the risk. You reduced your tiny risk of a heart attack by a fraction of a percent, but you increased your risk of bleeding out internally by a larger percentage. It was a net zero at best and a net negative at worst. The FDA reacted quickly. In 2019, they officially changed their recommendations, stating that aspirin should no longer be used for primary prevention in healthy adults over the age of 70. The American Heart Association followed suit. They now recommend that aspirin should only be used for people with established cardiovascular disease or for those with very high risk factors and low bleeding risk, and only after a deep conversation with a doctor. But here's the kicker. Despite these updated guidelines, millions of older adults are still taking their daily aspirin. Why? Because their doctor told them to 20 years ago, and they never got the memo to stop. Or they read old articles on the internet. Or they just assume that because it is over-the-counter and cheap, it must be safe. This is a classic case of medical inertia, and it is causing real harm. Now, I want to talk about the real damage. The title of this video mentions a drug that is slowly destroying your arteries. Most people think that the only risk of aspirin is stomach bleeding, and yes, that is a serious risk. But there is a much more insidious effect that is rarely discussed in mainstream media. It involves something called vascular calcification. Vascular calcification is the hardening of your arteries. It happens when calcium deposits build up in the arterial wall, making the artery stiff and brittle. Stiff arteries mean your heart has to work harder to pump blood. It leads to high blood pressure, left ventricular hypertrophy, and eventually heart failure. And here's the frightening part. Some emerging research suggests that aspirin might actually accelerate this process. How does that happen? Well, it goes back to that COX enzyme we talked about earlier. Aspirin blocks COX, which reduces the production of certain protective substances in the blood vessel lining. One of these substances is prostacyclin, which keeps the arteries dilated and flexible. By reducing prostacyclin, you are removing a natural vasodilator. Over years, this constant blockade alters the balance of the arterial wall. It shifts the environment from a protective, anti-calcifying state
to a pro-calcifying state. Additionally, aspirin use has been associated with increased oxidative stress in the endothelium. Oxidative stress is the rusting of your blood vessels. It damages the endothelial cells, which are the one-cell thick lining of your arteries. When these cells are damaged, they release signals that attract inflammatory cells. Those inflammatory cells then recruit osteoblast-like cells, which are cells that build bone. And those cells start laying down calcium inside the artery wall. This is called vascular ossification, and it is exactly what it sounds like. Your arteries turn into bone. Now, this is not a well-publicized side effect because it takes years to develop. Unlike a stomach bleed, which happens quickly and gets you to the hospital, arterial calcification is a silent thief. It creeps up on you over a decade. You might go to your doctor and they tell you that your blood pressure is creeping up, but they don't connect it to the aspirin you have been taking for 15 years. They just prescribe another medication, maybe a beta blocker, and send you home. This is the cascade of side effects that nobody talks about. One drug leads to another, and before you know it, you are on a cocktail of medications, all because you started with that cheap little pill that was supposed to keep you healthy. Let's dig deeper into the biology. The endothelium, which is the inner lining of your blood vessels, is a dynamic organ. It produces nitric oxide, which is a potent vasodilator. Nitric oxide keeps your blood vessels relaxed and smooth. It also inhibits platelet aggregation and prevents white blood cells from sticking to the vessel wall. In short, nitric oxide is the guardian angel of your cardiovascular system. Aspirin, through its mechanism of action, has been shown in some studies to reduce the bioavailability of nitric oxide. How? By increasing the production of reactive oxygen species, which are free radicals. These free radicals gobble up nitric oxide before it can do its job. So, as you take aspirin day after day, year after year, you are slowly depleting your vascular nitric oxide reserves. This leads to endothelial dysfunction. Endothelial dysfunction is the earliest step in the development of atherosclerosis. It is the precursor to plaque formation. So, paradoxically, by taking a drug to prevent heart attacks, you might actually be laying the groundwork for the very disease you're trying to avoid. But wait, there is even more. Aspirin also affects the kidneys. The kidneys play a crucial role in regulating blood pressure and electrolyte balance. They produce prostaglandins that help maintain renal blood flow. When you block prostaglandins with aspirin, you reduce blood flow to the kidneys. Over time, this can lead to a subtle decline in kidney function, which further exacerbates hypertension. High blood pressure then stresses the arterial walls, making them even more susceptible to calcification. It is a vicious cycle. The aspirin causes kidney issues. The kidney issues cause high blood pressure. The high blood pressure causes arterial damage, and the arterial damage becomes calcified. All while you are smugly patting yourself on the back for being proactive about your health. Now, I want to make a very clear distinction here. I am not saying that aspirin is evil. I am not saying that nobody should take it. There are specific populations for whom aspirin is a lifeline. For example, if you have a metal stent in your coronary artery, you absolutely need to take aspirin, along with a second blood thinner, to prevent the stent from clotting off. If you have had a major heart attack and your ejection fraction is low, aspirin is life-saving. If you have peripheral vascular disease or a history of transient ischemic attacks, aspirin is indicated. These are high-risk patients. The risk-benefit calculation is completely different for them. For them, the benefit of preventing a catastrophic clot outweighs the risk of bleeding or calcification. But for the average 55-year-old with slightly elevated cholesterol who walks 5 miles a week and has no family history of heart disease, the math simply does not support the aspirin use.
Let's look at the bleeding risk more closely. When you take aspirin, you are irreversibly inhibiting platelet function for the entire lifespan of that platelet, which is about 7 to 10 days. That means if you cut yourself, it takes longer for your blood to clot. More importantly, if you have a microbleed in your brain, which many people do without knowing it, the aspirin makes that bleed worse. A hemorrhagic stroke is often more deadly and more debilitating than an ischemic stroke. So, by taking aspirin to prevent an ischemic stroke, you are increasing your risk of a hemorrhagic stroke, and the rates are comparable. For every 10,000 healthy people taking aspirin for 10 years, you might prevent about 5 heart attacks, but you will cause about 3 major bleeding events. That is a razor-thin margin. And when you factor in the quality of life impact of a major bleed compared to a manageable heart attack, the decision becomes even more complex. Another angle that is rarely discussed is the gut microbiome. Your gut houses trillions of bacteria that influence everything from your immune system to your mood. Aspirin, even in low doses, is acidic. It alters the pH of your stomach and small intestine. Over time, this can disrupt the delicate balance of your gut flora. Recent studies have shown that long-term aspirin users have a different gut microbiome profile compared to non-users. They tend to have less diversity, which is a hallmark of poor gut health. Poor gut health is linked to systemic inflammation, and systemic inflammation is a driver of atherosclerosis. So, yet again, we see a pathway where aspirin might be fueling the fire it is supposed to extinguish. In terms of alternatives, the science is very clear. The best interventions for primary prevention are lifestyle-based. That means a Mediterranean diet rich in healthy fats, leafy greens, and whole grains. It means 30 minutes of moderate-intensity exercise at least 5 days a week. It means stress management. Chronic stress releases cortisol, which damages the endothelium. It means quality sleep. Poor sleep is associated with increased calcification. And it means monitoring your blood pressure and blood sugar. These are the factors that actually move the needle. These are the factors that prevent clots without thinning your blood and increasing your bleeding risk. There is no pill that can replicate the benefits of sweating and eating well. To wrap this up, I want to leave you with a thought. Medicine is an evolving science. What we believed 20 years ago is not necessarily true today. The aspirin story is a cautionary tale about the dangers of treating a population with a drug that only works for a select few. It is a reminder that cheap does not mean safe, and routine does not mean right. If you are taking a daily aspirin, I urge you to do your homework. Look at the latest guidelines. Look at the updated research. Do not rely on your father's doctor. Rely on the current evidence. Your arteries are the superhighways of your life. They carry oxygen and nutrients to every single cell in your body. They are resilient, but they are not invincible. They deserve better than a 2-cent chemical hack. They deserve real, tangible, meaningful care. The $5 drug is not a villain in a movie. It is not a cartoonish poison, but it is a tool, and like any tool,
It must be used with precision. Using it bluntly, using it indiscriminately, is where the damage happens. Millions of people take it daily, but millions of people are also unaware of the slow, silent corrosion happening inside their chests. Do not be one of them. Question your medications. Question the narrative. And above all, take control of your own health, because at the end of the day, the only person who has to live inside your arteries is you.